I mean, I just don't understand what it was that the panel was asking for. I understand the first part, coordinating with NVAC, but what is it? What's line 8 and 9 mean? What do they want?
Well, this is one of those areas where where we wrestled on the wording, and my sense of the panel was that this was an issue that we couldn't get consensus on regarding the vaccine safety, and we wanted to put some wording in here that the IACC would consider if they wanted to address this. There was some discussion about if too much emphasis had been put on the NVAC, and there were some comments made about the NVAC not having the research monies to go forward, and since the IACC had it, is it something that they should reconsider?
So the IACC and NVAC have virtually the same budget, which is almost zero. So there's no IACC research money. I thought so let me read this to you and see if this is what the panel wanted, because I just was confused. It looked like it was either two completely different concepts in one sentence, or it was one sentence that didn't have the right conjunction. To address public concerns regarding a possible vaccine ASD link, it will be important for the IACC to continue to coordinate with the NVAC. And then what I thought they were saying was that they want us to continue to coordinate with the NVAC to ensure that whatever comes out is informed by the best science on neurodevelopment and ASD risk. Is that what they were asking for, or do they want something around health surveillance?
It seemed to be a further explanation, or just more a stronger linkage between what the NVAC was doing with what we are trying to accomplish there in terms of driving there was concern that there was too much of a void between what NVAC was doing and what some of the members felt that the IACC should be doing. They wanted to draw a closer collaborative effort between the two.
I think you can accomplish that goal if you simply end the sentence after the NVAC in parentheses and don't include the rest of it.
Tom, I'm a little confused by this because this was actually from last year's plan, and at the time we did want to coordinate with NVAC, and shortly thereafter, in the first part of this year, we set up a meeting. Actually, I think it was July 15th, where we met with all the members of NVAC. NVAC has completed their work, and they have a document, the National Vaccine Advisory Committee's recommendations on the Centers for Disease Control, Prevention, Immunization, Safety Office. This is their draft 5-year scientific agenda. So we've already done that. Does it really need to be in the plan now, or should we just move forward with what was discussed at the meetings and the recommendations by NVAC? Because this, to me, is already happened.
So remind me, I thought that when we met with them, that one of the recommendations was to have a third party, they were talking about potentially Institute of Medicine body, look at feasibility questions and how best to pursue issues around vaccines and autism. And so when I read this, I thought what this meant was that we should continue to work with them to figure out how that could be done, and to make sure that whatever is done has people involved to actually keep autism in the forefront, so it doesn't become like that report about vaccine safety much more generically.
Yes and no. If you read the minutes to the meeting, actually this was a quote from you. Dr. Insel said that members of the IACC may struggle with the recommendation that the question of the feasibility for a vaccinated and unvaccinated study be booted to another committee, such as the Institute of Medicine. He asked if it would be beneficial to release a request for proposals to see whether a well-designed study could be proposed. And then Dr. Carlson said it would be possible for an investigator-initiated study to be funded and would not require committee's actions. Dr. William Robb supported the idea of issuing an RFP, calling it a wonderful, pragmatic tool with relatively low risk, and in the worst-case scenario, no high-quality proposals would be received.
Right. Well, so that's very much the way I felt about it then, and I still do, that we don't need an endless series of meetings to continue to look at the same question. But I do believe that what the NVAC is intending to do is to actually mount an additional, I think it's a meeting, I think it's an IOM session to look at this question. They felt that this was one of their items on their to-do list that came out of that joint meeting we had with them. And they have come to us asking for our support in this. It's not something that I'm particularly enthusiastic about, but if they do it, I think they ought to do it with people who are informed about autism. So does become a group that has, as it says here, it includes developmental assessments and outcomes to inform ASD research. So again, why I was asking what it was that the panel meant by this is I was confused whether the second half of the sentence had anything to do with the NVAC, and if it did, the only thing I could figure out was that it was about the next steps that the NVAC was going to take and to make sure that it was autism related, or if this is something completely unrelated to NVAC and had to do with asking the IACC to support efforts in public health surveillance of vaccine safety. And I just still don't know what it is that the panel is recommending, because those are two very different things.
Tom, could you reread the suggestion that you started out with that talked about to ensure that the best science?
Yes, this is based, and this is again at variance with what Lynn was saying, but it's based on my sense that the NVAC does intend to do something further that was in response to our original request around the feasibility question. What they said to us was that they didn't think it was ethical to do such a study of vax versus unvax, but they also recognized that there may be a need to look at this more fully, and they were willing to think with us about putting together a third party to explore it. And Lynn's quite right. At the meeting, I wasn't very enthusiastic about that. What I thought this was saying is that we should continue to work with them. And if we're going to work with them, it would be important for the IACC to continue to coordinate with the NVAC and to ensure that the best science on neurodevelopment and ASD risk are part of whatever it is they come up with. That's not the right language, but something like that. I thought our role here is to bring the best science on autism to whatever it is the NVAC decides to do.
I guess what I'm asking, Tom, is you also say that you felt spending another year in panels discussing feasibility would not address the urgency felt by parents currently grappling with immunizing siblings of their autistic children. And so I'm asking whether or not this really needs to go to another IOM report. If you actually read the NVAC report that came out, what they're suggesting, the type of studies being suggested would be an observational study of populations looking at natural variation in vaccination schedules. And this would be ones that have chosen not to vaccinate. It would not be a random controlled study. And where some children were vaccinated, vaccination has declined through parental intent. And we have states now that have between 5 to 6% of children that are unvaccinated. So I don't think that would be very difficult to find enough children to be in this study. And let's see, they go on to say, importantly, it might be difficult to control for co-founders in the study of health outcomes of vaccinated and unvaccinated populations. The baseline health and social characteristics may be different. That meaningful results may be difficult to obtain, but they still are endorsing that this feasibility study be done in their report.
So what they mean by a feasibility study, Lynn, as I remember it, was that this is something they want to hand over to a third party like the IOM to tell us how it could be done. And what I was saying was, I think actually you and I are saying the same thing. Do we really want to wait another year and have another IOM report at great expense to tell us how this could be done, rather than just deciding what could be done and figuring out a way to move forward with this? taking your comments seriously, I mean, one might argue for just deleting this whole section about the NVAC and saying they've, as you mentioned, they've done their report, we've had our meeting with them, and perhaps we don't need to go back to them for yet another long conversation and another IOM effort.